Welcome to today's lecture on the fascinating world of endocrinology. As medical students, it is crucial to develop a comprehensive understanding of the intricate hormonal system that regulates numerous physiological processes in the human body. Today, we will delve into the multifaceted topic of cortisol, a steroid hormone primarily produced by the adrenal cortex. Our exploration will encompass various aspects, including cortisol regulation, measurement techniques, and clinical implications. So without further ado, let's embark on this enlightening journey. The adrenocorticotropic hormone, ACTH, stimulation test is a diagnostic tool used to assess the adrenal gland's ability to respond to ACTH. ACTH is produced by the anterior pituitary gland and stimulates the release of cortisol from the adrenal cortex. This test involves administering synthetic ACTH to observe cortisol secretion levels. Abnormal results may indicate adrenal insufficiency or related pathologies. Cortisol secretion demonstrates a characteristic circadian rhythm, with the highest levels typically observed in the early morning and the lowest levels during nighttime. This rhythmic pattern is regulated by the hypothalamic pituitary adrenal (HPA) axis, which coordinates the release of cortisol in response to various stressors. Disturbances in cortisol circadian rhythm can contribute to conditions such as insomnia, mood disorders, and altered immune function. The adrenal cortex, the outer layer of the adrenal gland, is divided into three zones: the zona glomerulosa, zona fasciculata, and zona reticularis. Each zone synthesizes different hormones, including cortisol. The zona fasciculata is primarily responsible for cortisol production under the control of ACTH. Understanding the adrenal cortex's anatomical organization aids in comprehending cortisol synthesis and regulation. In chronic stress, there is a dysregulation of the hypothalamic pituitary adrenal (HPA) axis, leading to prolonged secretion of cortisol. This elevated cortisol levels persistently and negatively impact multiple physiological systems, including the cardiovascular, immune, and nervous systems. The dysregulation of the HPA axis in chronic stress plays a pivotal role in the pathogenesis of hypertension, obesity, and depression, among other conditions. Understanding the mechanisms and consequences of HPA axis dysregulation in chronic stress is crucial for identifying potential treatment strategies and minimizing the long-term health consequences associated with chronic stress. Cortisol plays a vital role in modulating immune function. In times of stress, cortisol inhibits immune responses, reducing inflammation and suppressing the immune system's activity. However, prolonged cortisol elevation can lead to immune suppression and increased susceptibility to infections. Understanding the delicate balance between cortisol and immune function is crucial for managing immunological disorders and autoimmune diseases. Furthermore, saliva cortisol measurement provides diurnal cortisol profiles, allowing for the evaluation of circadian rhythm patterns. This is particularly useful in assessing HPA axis dysregulation, such as in Cushing's syndrome or adrenal insufficiency. Additionally, measuring salivary cortisol can be helpful in monitoring stress levels and evaluating the effectiveness of stress management interventions. To measure salivary cortisol, samples can be easily collected at specific time points throughout the day using salivettes or other collection devices. These devices contain a cotton or synthetic swab that is placed in the mouth to absorb saliva. The swab is then placed in a tube, and the cortisol concentration can be determined using various laboratory techniques, such as enzyme-linked immunosorbent assay, ELISA. It is important to note that salivary cortisol levels can be affected by various factors, including oral hygiene, diet, and medications. Therefore, it is crucial to standardize the collection procedure and consider these potential confounding factors when interpreting the results. In conclusion, salivary cortisol measurement is a valuable tool in assessing adrenal function and HPA axis activity. Its non-invasive nature, ease of collection, and correlation with free cortisol in the blood make it a reliable and convenient method for evaluating cortisol levels in both research and clinical settings. In critically ill patients, the assessment of cortisol levels is particularly challenging due to various factors. Physiological changes associated with critical illness can significantly influence cortisol levels, making interpretation of results complex. Additionally, the administration of high doses of corticosteroids commonly used in intensive care units can interfere with cortisol assays, posing further obstacles in accurately measuring cortisol levels. Therefore, healthcare professionals need to exercise caution and take into account these unique challenges when assessing cortisol function in critically ill patients. In the section of pseudohypercortisolism, we will discuss a condition that mimics Cushing's syndrome but does not involve excessive cortisol production. Pseudohypercortisolism can occur due to changes in cortisol-binding globulin, tissue sensitivity to glucocorticoids, or alterations in cortisol metabolism. Recognizing this condition is important to distinguish it from true Cushing's syndrome and avoid unnecessary treatments. Identifying the underlying mechanisms of pseudohypercortisolism will provide insights into the complex regulatory pathways involved in cortisol regulation in the body. Liquid chromatography mass spectrometry, LCMS, has emerged as the gold standard method for cortisol measurement. LCMS offers high sensitivity, specificity, and accuracy, allowing precise quantification of cortisol in various biological samples. Its ability to differentiate cortisol from structurally similar compounds ensures reliable and robust results, making it a preferred choice for cortisol measurement in research and clinical settings. Neuroendocrine tumors, NETs, can produce excessive amounts of cortisol, leading to a condition known as ectopic Cushing's syndrome. These tumors, often originating from organs such as the lungs or pancreas, can autonomously produce cortisol, bypassing normal HPA axis regulation. Diagnosis and management of cortisol-secreting NETs require extensive hormonal assessments and localization of the primary tumor. The high-dose dexamethasone suppression test is a valuable tool in assessing adrenal function and identifying conditions like Cushing's syndrome. To conduct this test, a synthetic glucocorticoid called dexamethasone is administered in high doses to intentionally suppress the body's natural production of cortisol. By measuring cortisol levels before and after dexamethasone administration, healthcare providers can distinguish between different causes of Cushing's syndrome and make an accurate diagnosis. This test plays a crucial role in understanding adrenal dysfunction and informing appropriate treatment strategies. Genetic factors play a substantial role in determining cortisol levels and how individuals respond to stress. Variations in genes responsible for regulating the hypothalamic pituitary adrenal (HPA) axis, metabolizing cortisol, and influencing cortisol receptor sensitivity can all impact the production and signaling pathways of cortisol. Investigating these genetic influences allows us to gain insights into the differences in cortisol levels between individuals and their vulnerabilities to stress-related disorders. By unraveling the complexities of genetic influences on cortisol, we can enhance our knowledge of endocrine physiology and potentially develop more personalized approaches to managing stress-related conditions. In conclusion, cortisol regulation, measurement, and clinical implications are critical aspects of endocrinology. Understanding the intricate mechanisms governing cortisol secretion, its diurnal patterns, and aberrations leading to pathological conditions equip healthcare professionals with the knowledge needed to diagnose and manage various endocrine disorders. As future physicians, it is essential to continue exploring this vast domain to provide optimal care for patients.